one. It's not only about our climate, it's also about our health. So there's no chance, even for those who deny all the climate issue, to skip this factual or facts about the impacts of or the consequences of the climate change on our health. I'm happy today to welcome our distinguished speakers, Prof. Jeremy Lim. Prof. Jeremy Lim is the director of the Leadership Institute for Global Health Transformation at the National University of Singapore, South Sue Hock School of Public Health. Also, Ms. Lama Zakzak. Ms. Lama is a principal researcher at Mohammed bin Rashid School for Government in Dubai. And of course, Dr. Elda Ansamo, a principal policy analyst at Kenya Institute for Public Policy Research and Analysis. Kipra, one of the best think tanks, I think not only in Kenya, but also in all the African continent. So welcome all of you, and we will start our webinar. This is the third webinar of the T28 series of virtual workshops. T28 is an official advisory platform for COP28. We conduct these webinars, and we will also have a lot of on-site sessions according to the T28 activities plan. Our webinar today will be the human thermometer, unmasking the health consequences of our changing climate. As I mentioned before, this is a very important subject. It's not only about our climate, it's also about our health bodies. So to give like general insights about this important topic, I'll start with you, Prof. Jeremy Lim. You are specialized in both policies and health. So this is the magical combination. So please, the floor is yours.
Thank you very much, and a good day to all of you, and greetings from sunny, very, very sunny Singapore. We are 1 degree north of the equator. We are a tiny island, and rising tides will make us look a lot more like the Netherlands. And therefore, climate change is very real to us. It is existential. In fact, at the COP later this year, Singapore is going to set up its own pavilion, and my own university, the National University of Singapore, will be sending a very large delegation of healthcare professionals, climate change studies, even our university president. He will be spending the week there because that's how important climate change is to us. On this topic around shaping healthcare globally, permit me to divide my comments into 4 parts. All right, and the first is the obvious one. I think we are just coming out of summer in particularly Europe and in North America. That has been the hottest in living since historic records started. And interestingly, last year 2022 was until 2023 the hottest that was on record. And in fact, a paper in Nature Medicine that just came out last week. And for those of you who are not in the healthcare world, Nature is probably one of the top healthcare journals globally, right? And this study looked at Europe and calculated that from May to September 2022, just last year, a year ago, there were 62,000 deaths that could be attributed to heat-related injuries. So clearly, the increase in global temperatures, particularly in the warmer months, have been very, very hazardous to human health. But beyond the direct effects, for us as medical professionals and as public health specialists, we are also very concerned, and I'll go to my second topic, which is the increase in vector-borne diseases And in the interest of time, Mohammed, I will limit my comments to mosquito-borne disease and focus on malaria as well as dengue. And essentially what happens is that when the temperatures go up, or when more parts of really the world get warmer, the mosquito as a vector finds it easier to breed. The geographies or the latitudes that allow the mosquitoes to thrive extend. And a paper I think 2 years ago, and this was in the Lancet, which is another very prestigious medical journal, estimated that malaria will increase depending on the specific geographies between 1 to 6 additional months. And this will be most profound in the tropical highlands in the African region. And maybe Dr. Elder could say more about that later, as well as the Eastern Mediterranean. Over in my part of the world, and Singapore, thankfully, so far has been malaria-free for probably the last 30 years, but we have dengue. Really, malaria tends to be a more rural disease. Dengue tends to be more urban because it's a different mosquito. Is the Anopheles versus but they thrive in urban climates with clean, stagnant water. And unfortunately, dengue will increase in the lowlands in the Western Pacific, which is where Singapore is, by 4 months, because typically we'll have dengue peaks during the summer, right? Or at least what constitutes summer in the tropics. But this window, this 1-2 month period where dengue rates are highest, is estimated to stretch by an extra 4 months, which means that effectively almost half of the year, we will have higher rates of dengue, right? And this then means that that quite unfortunately, there are tropical disease belts that, as the name suggests, are around the tropics. But as this belt widens, more and more the vector-borne disease, in this case, really mosquito-borne disease, they will spread to more and more regions. And this is problematic, not just for the disease burden, but when the outbreaks occur in areas where people are immunologically naive, meaning that they have not been exposed to the disease before, the disease severity will be much worse. And of course, public health systems, the further north you go away from the tropics, public health systems will be less and less prepared because they just don't expect to have dengue, right? And therefore, these are the sorts of things we need to plan for. The third thing that I wanted to highlight, Muhammad, if you permit me the time, is really around something that we have lived through the last 3.5, 4 very difficult years. And in some parts of the world, we are still living through, which is essentially zoonotic disease risk, right? And there is a Chinese saying, 井水不犯河水, which essentially means that the river water doesn't disturb the well water and vice versa, right? And in the good old days, man and animal pretty much had our own ecosystems that were geographically separate enough. But as temperatures rise, as the environments for the animals become harsher and more difficult, and as we as men extend further, we then start to overlap, right? And changes in climate, changes in land use will then cause the ability for us as humans and the various viruses and other microbes that are resident in the animals to interact. And there was a very nice study done in Nature, published last year, that essentially estimates that of the 10,000 odd virus species that have the ability to infect humans, these are 10,000 that and the ones that we only know of, influenza, COVID, or the SARS-CoV-2, are just a fraction of the many viruses that could infect humans. But we typically never come into contact with them. However, as our ecosystems start to overlap, there is a very real risk, as depending on what you believe is the cause of COVID, there's a very real risk that these overlaps will facilitate what in the lingo is described as a zoonotic spillover, where there is a mechanistic link. The diseases spread from animals into humans, and the estimate is that at least 4,000 of these viral transmissions, they will occur, and particularly in bats. So here in Southeast Asia, where I am based, we have established a large zoonotic disease surveillance program. So believe it or not, some of my colleagues in the National University of Singapore spend a couple of weeks every year hanging out literally in bat caves, because bats are probably have been anticipated by experts to be the most likely cause of the next pandemic, and hence surveillance will be absolutely critical. And then finally, beyond the physical effects of higher temperatures, beyond the increase in vector-borne diseases such as the mosquito-borne ones, the risk of zoonotic spillover, finally, as what we are seeing with fires and floods, all these humanitarian disasters, all these public health emergencies disrupt routine care. And our healthcare system today, even in peacetime, is already under a lot of strain. The World Health Organization estimates that the world is short of 13 million nurses. Let me say that again, 13 million nurses. And before the pandemic, the World Health Organization and the World Bank did a comprehensive study and estimated, and this was in 2017, estimated that 52%, more than half the world, lacked access to essential health services. And not just that, in that same report, it highlighted that 100 million households around the world go into bankruptcy, go into poverty due to medical reasons. So I put it to you that the healthcare system is already, without pandemics, without climate change, is under tremendous strain. And any worsening will further disrupt routine care and cause that sort of overcrowding that we're seeing in many countries at the start of the COVID pandemic. And this will be detrimental to all of us. And particularly, I just want to close off by making a call for all of us as human beings to remember and put equity at the front and center of all the efforts that we undertake. Because as has been said during the pandemic, and to some extent it occurs in climate change also, we may be all in the same ocean, but we're in different boats. And some boats are better able to rise with the rising tide, and others are going to be capsized with all sorts of bad things happening. So I do hope that I've given you a very quick overview of how climate change is reshaping how we think and how we worry about healthcare globally. And on this note, Mohammed, thank you. I will hand the time back to you.
Thank you, Professor Jermin. That was very informative. 4 points. However, they were also very, I don't know, maybe pessimistic. None of them is optimistic. I was hoping you will, like after you raise all of these risks, that you will see still we have some hope. We have kind of resilient global health system, but even that, okay, you mentioned we don't. Anyway, I will.
Mohammed,
we will come
hope
to
is
that.
a good breakfast, but a poor supper, right? This evening here in Southeast Asia.
Yeah, we will come to talk in details about the readiness of the global health systems. And in the meantime, I will go to Ms. Lama Zakzak to ask you, Ms. Lama, how do you envision the interplay between the climate change and the global health?
Sure, thank you. And we just a comment to Professor Jeremy. We are looking forward to see you at COP. Mohammed Barash at the School of Government is also involved in the conference, and we're looking forward to it. Just about the question, I think it's very important here to basically ask a follow-up question is how climate change is a different emergency from other emergencies that we have faced on a global health level. Also, Prof mentioned the COVID-19 pandemic, which was a worldwide public health emergency. However, there are similarities. We can learn a lot from it about how to handle such a global level emergency. But at the same time, climate change is even adding more complex layers to the equation. So in terms of the way climate change is impacting the ecosystem and impacting our well-being and our lives, it's basically causing conditions that they exist in. We've dealt with it before. However, climate change is making climate hazards more intense. It's making them more frequent, and it's also contributing to lengthening the duration of climate hazards that we are being exposed to. The second thing is, as Prof talked about, is the shifting patterns of diseases, and there are a lot of factors. I'm not going to go into them. I think he covered them well. Infectious diseases, the patterns, the shifting patterns, where they are appearing, where they are intensified, and actually where unfortunately they're reappearing in countries that have eradicated them. They made gains in public health, and now they're finding themselves that they have to deal with them all over again. The third point, which is the most important point that characterizes climate change, is the transboundary nature of climate change. It is not a one country problem. It's not the one region problem. We are literally, as a whole globe, dealing with it. And we cannot, we've seen this happen in the pandemic before, where countries had a little bit of control of closing borders, for example, or there's a question about protecting the resources. So some countries were able to say that we will keep the resources for certain uses. However, when we look at climate change, I can give a very recent example. If you follow the news, we've seen the wildfires in Canada. There have been reports of increased asthma AR visits in America. So we cannot really draw the line between who gets impacted and who not. The fourth and final one is the climate change is impacting ecosystems and people. And we are connected to ecosystems, and ecosystems are connected to us. So it's not a virus that is running around impacting people only, but it's something that is going on, impacting the plants, the animals, our ocean systems, our atmosphere. It's like it encompasses everything. Unfortunately, I would like to stress the point about equity. It happens, another characteristic of how climate change is unfolding is that the countries that are least prepared and least able to cope or adapt to the impacts, they are the most impacted. We have, especially when we talk about island countries or countries with poor infrastructure or with high prevalence of poverty, these countries are being hit the hardest and yet unable to adapt or deal with the climate impacts. I will hand it over to you.
Thank you so much. Thank you. Now, Dr. Elda, still we don't have any like optimistic overview yet. Okay, still maybe it's not my speaker's fault, but maybe it's really we are facing a very close nightmare when it comes to as Ms. Lama mentioned, to the dual action of the climate change. It's not only It's not only to direct impact on our health, but it's also on the ecosystem that we will eventually also has its impact on us. And yes, I know, Prof. Jim, it's very hard to be. I appreciate your honesty. It's very hard to be optimistic when it comes to this really scary issue, the induced health consequences, the climate-induced health consequences. So, Dr. Elda, your insight, please, about this issue. The floor is yours.
Thank you. First of all, I wish to observe that climate change is the greatest threat to humanity because its implications are two-sided. In Africa, for instance, it can manifest itself through either increasing temperatures, where we have very high temperatures, particularly in the arid and semi-arid lands. But we also have the other side of floods, which are a major cause of accidents. According to the World Health Organization, some of the natural disasters that African countries face are majorly associated with climate change consequences, like floods, which then means the high cost of accidents in the health system could be prevented if we were able to manage such ecosystem issues like managing floods through strong investments in technology on water management. When it comes to droughts, when we have very high levels of heat related incidents, then we are likely to face as Africa high incidences of non-communicable diseases, such as respiratory diseases. And this has been observed as one of the major challenges, not only affecting Africa, but most of the countries across the globe, because diseases like asthma, they become aggravated when it comes to high temperatures as well as cold weather situations, which then means if we have very low temperatures, then the humanity is having a major consequence when it comes to being vulnerable to communicable disease like asthma. We also know that climate change has a consequence on food security. As much as African countries have prioritized food security and nutrition, climate change leads to very erratic food production, high prices. Then we end up having children who are malnourished and even adults who are not meeting the World Health Organization basic nutrition provision. This has long-term implications. According to the cost of hunger study undertaken by KIPRA and the Kenya National Treasury, it emerged that the country loses close to 6.9% of the GDP to malnutrition. And this is equivalent to the budget then that goes to the education sector, which means if we are able to manage the consequences of climate change, then we'll be saving resources that can be used for other critical sectors, which also enhance the attainment of sustainable development goals and sustained growth and development. Another consequence relates to the implications on equity and the gender lens of climate change and health. We know that the most affected people are women, and also we have children. In other cases, we have men who also have to take care of livestock, for instance, when it comes to droughts. So these categories of humanity then have diverse implications. First, their health is compromised. Second, they are not able to productively engage in the labor market. that it affects the future of Africa's human capital development. Another implication comes in the area of water, sanitation, and hygiene. We know that with the climate change and also droughts, we have high levels of waterborne diseases like cholera and others. If the incidence then increases and we do not have strong systems of managing water, then it means we are spending more money to manage preventable conditions of health, which could have easily been managed if we invested in water management, among others. Then we have early warning systems. Countries in Africa, including Kenya, have invested a lot in early warning systems, use of technology, use of spatial technology, and also use of climate skills to ensure that we are able to predict what is coming ahead in terms of forecasts. But the level of uptake of early warning systems findings is quite low. So one call then, as I come to an end, is first of all to invest in data, which can help us inform decisions on these consequences of climate change on humanity, and also on how climate change affects other ecosystems like livestock and also in food production. I therefore indicate as follows as a priority for the T28. First is to prioritize human well-being in all the key climate change decisions, discussions. We have to make a call to stop the use of other fuels like fossil fuel that increase the vulnerability of humanity when it comes to climate change. We need to tax polluters. We need to ensure that we implement the World Health Organization air quality guidelines, not only in the developed countries, but also in the developing countries. And finally, advocate for sanitation, adequate access to improved water, especially for drinking, for both humans and animals, and also ensuring that we have strong water management systems in Africa, particularly when we have high levels of floods. We need to save this water to be used during the time when we have the dry spells, and that can also be used by humans, animals, as well as for crops, that is in irrigation, which is very important to manage not only nutrition, but also food safety in totality in Africa. Thank you.
Thank you, Dr. Elder. That was a very informative and remarkable recommendations. And again, I will ask Prof. Jeremy then, as he mentioned the vector-borne disease. Prof. Jeremy, are we really in front of a radical epidemiological shift induced by climate change? Because some people can argue that the epidemiological shifts, okay, can be attributed to many factors. How we are sure that we are in the front of this kind of climate-induced shifts or epidemiological transitions?
Yeah, really, Mohammed, I think of climate change as really selective pressure and apply it to Darwinian evolutionary theories. Mm-hmm. So as changing temperatures, as really pollutants shape the environment, two things happen. One, there is a selective pressure so that the pathogens or the non-human species that are more adaptable, and particularly those that have very short life cycles. So like for example, one of the things that I do here in Singapore is that I run a gut microbiome really research program, and the 100 trillion microbes that sit inside our gut are very important to many aspects of human health. But the microbe's life cycle is typically 30, 40 minutes. So over a week, over a month, many life cycles would have occurred. Humans don't evolve so fast. So we are actually, we need to survive with whatever we have within our lifetimes, because our own lifetimes they are really long enough. So the external pressures, we are not able to evolve. We suffer from them. Higher temperatures, the heart needs to work harder, the blood vessels need to pump harder, and this then increases the risk of things like heart disease. And I think that Dr. Elda spoke about food, and as food becomes, and as fresh food becomes more difficult to achieve or to attain, we will eat more foods that are what are classified as ultra-processed foods, which have a pro-inflammatory effect that then leads to accelerated cardiovascular disease and really so on. So I'm afraid, Mohammed, everything points in the wrong direction. The kind of mitigants you ask, is there hope? Within the human body, we may not be able to evolve quickly enough, but our microbes can. And there is this theory in the microbial world around microbiome flex, meaning that there are some humans, special forces soldiers and so on, who just seem to be a lot more resilient. And can we modify our insides? Can we change the clothes we wear and all that so that we can adapt better? The answer is yes. Can we change the foods we eat? Can we selectively breed for hardier strains, those that can survive with a bit of salt in the water? The answer is yes also. So there are some glimmers of hope, but overall, I would say that the most important thing as it pertains to climate change is that we have to figure out ways to reverse it.
Okay.
The adaptative measures will help us, but to a fairly modest extent.
Thank you, Prof. And that's actually answering one of our audience's questions. He asked about to give like examples about how some climate hazardous enhance pathogens and by like influencing their ability to be more or to make like more extreme conditions. Thank you for lighting that. But again, I have like, especially regarding the vector-borne disease. Okay, and I think you have a special interest in that according to your research interest area. Are we now about a new redistribution? I'm talking epidemiological wise. Redistribution, okay, which are the most affected area will be about by the climate-induced vector-borne disease, this epidemiological transition of a vector-borne disease. Are we will see like endemic what usually we see like endemic regions that will be kind of pandemic, or we will have like change in the endemic regions for malaria, for example. Can we see it in the North Europe? Okay, can we see the Rift Valley fever in the East Asia? Are we
the short
in front
answer
of that scale?
The short answer is that Mohammed, we are staring at this. It will be almost like it will be like a gentle wave. If a particular vector-borne disease is confined to 2-3 degrees on either side of the equator, in a year from now it might be 5-6 degrees rather than 2 degrees. So areas that traditionally have not had malaria, have not had dengue, may actually find that they'll see more and more of these. And those areas which have these vector-borne diseases that are more severe in specific months, if we have if we used to have 3 months of summer, but now we effectively have 6 months of, well, summer, then we'll have 6 months worth of higher levels of these diseases. So I am afraid that's just the reality we need to encounter. Science, and we as scientists are fighting very hard to figure out how to modify the mosquitoes so that they are less infectious, they don't transmit malaria or dengue so effectively. There are some glimmers of hope that we can balance or at least seek to mitigate. But certainly, really, Muhammad, I go back to the same basic point. If we can stop climate change, if we can reverse some of the effects, that would be by far the best outcome.
Thank you so much. Ms. Lama, I need you to also enlighten us about regarding the infectious outbreak. Okay, I think all of us learned our lessons from Corona. Okay, but now if we like combine two nightmares, the climate change and the pandemic or infectious outbreak, okay, is that predictable based on the prediction of the climate change itself, on our models of climate change prediction? Will we see this kind of infectious outbreak? Is there a probability for that?
That's a very interesting question. And from a climate change point of view, climate research, it is very difficult to accurately predict what is going to happen. So we have normally a general idea. Even when scientists run climate scenarios, run their models, they do get results. But the thing is, climate change is a very complex challenge and subject to so many changes that can be governed even outside the climate. If we're talking about, it could be a political, could be social, could be economic. So many factors enter into the equation. So it's very difficult to accurately predict. However, generally speaking, the research does indicate that as temperatures continue to rise and as climate change impacts continue to unfold, we are going to experience more and more, maybe not widespread diseases, outbreaks, but it could be some countries could experience intensified spread of diseases. Some countries might start experience the outreach of the disease might expand. However, if we're talking about, as I'm a climate hazard heat governance researcher, so I can tell you my point of view from heat and climate hazards. So, for example, if we take it from that perspective, some countries are experiencing both more intense and more frequent flooding. At the same time, they're also experiencing heat waves and higher heats. So put these two things together, you are creating, when you have stagnant water and heat, you are creating the perfect environment for breathing different type of diseases. So you have all of these factors that you have to take into consideration when you look at this. You have to look at it, from a geographical point of view, from a climate point of view, and see what's happening on the ground.
Thank you so much, and I want actually also to be, if you kindly can educate us from your expertise about this heat-related illness. Okay, we are now talking about the non-infectious disease. Can we talk about some conditions that about the CHF, chronic heart failure, about even the high blood pressure, even about the mental related issue because of the stress related issue. Can you please enlighten more about in which situation now, okay, we are regarding the seriousness of this kind of heat-related illness?
Sure. So the first thing we have to look at is what region are we talking about? So some regions are suffering more than others. Some countries are suffering more, and some cities in particular are suffering more than others within the same country.
Is that because the prevalence of the some conditions, or because of the seriousness of the climate change at that regions?
So it is. So when we look at the vulnerability to climate hazards, we're looking at exposure, and we're looking also at other structural factors that impact people's vulnerability to the exposure. So are they do they have the resources to adapt? Do they have the strong systems that allow them to adapt and get over it, or prepare or prevent? So we're looking at these things. But when we talk about heat, we have to also differentiate between two things. The first one is the annual average temperature that is rising across the globe, and we also have to have the second category, which is the extreme weather event, which produces extreme heat. And this is the one that we hear about in the media, a heat wave hit a certain region or a certain city. So the second category is a public health concern. And normally, public health systems should have measures for preventing, for raising awareness, and for treating any illnesses or injuries that might result from this.
Okay, we'll come to this proactive measures that should be taken in front of all these risks. I will now just ask Dr. Alda. Dr. Alda, you mentioned about this dimension sometimes of the climate change, or the impact of climate change on the health is not already well known by a lot of people. The malnutrition, the nutritional deficiency. Okay, but how can we ensure that the nutritional insecurity and accordingly the malnutrition is due to direct climate change impacts, not to other factors? Because this is like a very, very complicated issue when it comes. It's maybe by bad agricultural practice, by some man action, a lot of reasons may be linked there. So how can we be sure that it's a climate-induced effects?
Thank you. The first entry point could be measuring this malnutrition by region. We have urban areas, for instance, due to other deprivations, we have low levels of nutrition. But when it comes to the arid and semi-arid lands, obviously it is due to climate change. Another indication could be where we have low food production, because if you have low food production and you have high levels of temperatures, all where we have floods and then there's no food to consume, then obviously that is related to climate change. And that's why I was talking of the need to invest a lot as African countries in this micro-level data, which can help us distill the effects of climate change in various dimensions, which one of them includes malnutrition. Which then points us to another area of mitigation in terms of looking at advocacy and education, the issues of social response in these regions, the human adaptation, and also how we look at the social development in totality in areas where we have high levels of incidence of temperatures as well as high levels of floods. Thank you.
Thank you, Dr. Elda. Again, this is, I think, we need to highlight this more, even in our like policy papers and research papers that will be included in the T28 comprehensive report, the final one, which should be handled to the top internal leadership and the external stakeholders as well. I mean, the malnutrition, the water deficiencies related illness, that's a very important thing, and it's something that unfortunately we can see and feel everywhere. Now, again, Dr. Prof. Jeremy, I want again to ask you about the infectious disease, okay. The outbreaks, the infectious, are we ready? Have we learned the lessons, okay, that we had from Corona? I mean, global scale. I'm talking about international level, okay? Or we still hide behind our protectionisms, some nationalisms, some political concerns under the general umbrella of national interests, okay, not rather than the global interest. What if we have this like nightmare scenario, as I asked Ms. Lama before, what if we have an infectious outbreak induced by a very serious and stressful climate like event or climate change?
Well, I think if I can be very blunt about it, the science of outbreak and pandemic management has improved by leaps and bounds, and that seems to be an enduring lesson. Even today, the WHO, various international organizations are really assembling teams to address what they call the 100-day challenge, where upon a new outbreak, a novel pathogen, can the genetic makeup be sequenced be known within 24, 48 hours, and can the vaccine production or the therapeutic production then be developed, instituted, and scaled up within 100 days. And the science of the platforms like the mRNA vaccines and so on appear very promising. I do hope that these scientific initiatives, which are not inexpensive, will continue to be well funded. The parts that are more worrying are that governments' ability to think long-term, think greater good, think beyond borders, as what Ms. Lama shared. I don't think that has improved at all. In fact, I would suspect it has gotten worse. And overall, I fear that in the next global crisis, whether it is a pandemic, whether it is a climate catastrophe, we are looking to science to save us from not just the catastrophe, but for science to save us from ourselves. And I'm more optimistic science can mitigate whatever catastrophe comes our way, but can science save us from ourselves? I'm a bit more cynical there. Yeah.
So do we need to employ, for example, the artificial intelligence for prediction models, this new technology, like whatever that we can, we are used to employ in the wars? Okay, can we make it now more beneficial and employ it
we are already doing all of these. We are already doing all of these. The difficulty is like what was said during the COVID pandemic, we can build the best vaccine in the world, but if we cannot persuade individuals to roll up their sleeves to get vaccinated, we have not succeeded. And here, I think we will find that there will be technological, I won't call them solutions. There will be technological mitigants, but they will involve some degree of trust and some degree of discomfort or inconvenience. And as a human species, I don't know whether we will rise up to that challenge.
Thank you so much. Ms. Lama, I want also to ask you about something related to to rising global temperatures. What specific illness become more prevalent in the recent years, at least when we witnessed, all of us, like this unprecedented rising of the global temperature, and what are their direct impact on human health?
Sure. So when we talk about heat, we ultimately talking about heat-related illnesses, and there are other type of matters related to well-being that I will discuss after this. But when it comes to heat-related illnesses, it is very well known that there are certain groups that are more vulnerable to others. Within the public health sector, these groups can be identified as the elderly, children and infants, pregnant women or nursing women, people who are living with pre-existing conditions, including cardiovascular diseases, anything that has to do with the ability to breathe well, diabetes, kidney. People who work outside are also under more exposure than others, and city dwellers, people who live in cities. The reason for this is something called the urban heat island, which is the structure, the way the city is built. It's built from materials that basically absorb heat, and then it releases that heat when the sun goes away during night. So all of these factors put certain people under or within the vulnerable group category. There is also research now indicating that heat contributes negatively to mental health. Climate change in general contributes negatively to mental health through climate anxiety, climate dread, behaviors that people engage in, something called the doom scrolling, and the media might attempt to exaggerate certain titles or report on things very frequently, and then people will panic and start to engage in doom scrolling. So all of these things basically are direct or indirect impacts from heat. Another thing that is often also coupled with heat when we talk about health and well-being is air pollution. Now, air pollution, it's the connection between air pollution, heat, and climate change is it's very complex, but I can maybe summarize it within a few points. Yeah, the air pollution and climate change are connected through the way they are caused. The burning of fossil fuels, for example, the same mechanism in many ways that contributes to greenhouse gas emissions also contributes to the production of certain pollutants that are harmful to the human body. In another way is in certain regions where sand or dust storms are known to occur, climate change might also contribute to reducing the moisture by changing the rainfall level, or the rainfall pattern might reduce the moisture in soil, causing faster and more spreading soil erosion. And that will intensify, especially if we combine it with changing wind patterns. If we have stronger winds due to climate change, combined with that, you will have stronger a sandstorm or stronger dust storms, which significantly contribute negatively to air quality. The other, we're hearing about this very, very much in the past few years, which is wildfires. Wildfires is also connected to climate change, and how by climate change is making the world drier. The rising temperature is turning certain areas that were able to retain moisture into tinder boxes, basically, where you have the vegetation that is dry, and then you have the extreme heat conditions, and then when they ignite, nowadays, due to climate change, wildfires are becoming more frequent, they're becoming more intense, and they are spreading on larger and larger scale and faster. So all of these things contribute to reducing the quality of air at the same time. So you have these things combined, different impacts, different also impacts on health.
Thank you so much. Dr. Elda, again, regarding the food insecurity that we have everywhere now, and again, for a lot of reasons, but for the climate-related reasons, do we have food sources that are more vulnerable than the others? How we I mean, are they like crops, certain crops or certain food sources that are hit by climate change more than others?
No, Muhammad,
Yes, we
look at the wine.
This is for Dr. Elda, please.
Yes, please, Dr. Elda, go ahead.
Sorry. Yeah.
Okay. Yes, we do have food crops that are more vulnerable to climate change, whereas others are not. And that's why, particularly in Africa, we are talking of drought-resistant crops and also going to indigenous foods, which in a way require less amount of food. They can be resilient, and they are even more nutritious. Unfortunately, in Africa, we find a lot of focus on the food crops that are vulnerable to climate change, such as maize, wheat, beans, among others, which then brings us to a question on how then do we draw a balance between the crops that are resilient to climate change conditions and those that are not resilient, but we know they have higher demand. I take a simple example of maize as sweet potatoes, for instance, or green grams, which are more nutritious, they are drought resistant, they can be grown in the areas that have been left behind, because for those communities, they still value those crops like pumpkin, and it can grow in areas where we have low amount of water. So in that case, then for us to be food secure, we need to adjust the way we compute. In most cases, our food baskets entails the crops that are not resilient to food security dimensions like floods and droughts. Whereas crops like beans, potatoes, pumpkin, they are not in that balance sheet. So going forward, we need to ensure that they are included for food security. Another area when it comes to food security investment is to do with technology. Managing water is an expensive undertaking, but we do not have two ways about it. There are countries like Israel where water is recycled. Why is Africa not then investing in high level of technology, not only in irrigation, but also in water management, water recycling systems, water reuse systems, as well as water management systems, because that is the only way we can ensure that we are food secure. It also takes us to the level of how we manage food. It has been established that despite the gaps in production, we have high levels of food wastage. And this wastage, in some cases, is associated with climate change, particularly when we have floods. The food can be produced, but all of it is swept away because we had floods. Or there's no wood road network to move it from high production space to low production area. Then that takes us to the logistics and market systems where we need to invest in addition to advocacy, in terms of ensuring that we diversify our food baskets, not only in high potential areas, but also in the hard to reach areas, arid and semi-arid lands included. Thank you.
Thank you. Dr. Elda, are you suggesting to be like somehow selective in our agriculture investments, or go to smart agriculture, okay, by choosing our groups to face this climate change? Is that your suggestion, if I may get you right?
Sure.
But is that applicable? Is that applicable in the, because there's like the market law, the food market law. Okay, there's a lot of rules, there's a lot of competition, many financial and political issue here. It's not only about what we need, that we will only make farm what we need. It's not like this. Is that applicable to be selective? Do we have that privilege to be selective for the crew?
Hard decisions have to be made because, as you rightfully put it, political economy is an issue. Because when it comes to food production, the people who produce food in massive levels, particularly in Africa, are the politically correct, or rather those who have a better muscle to invest in large-scale production. That said, still Africa has small-scale farming, constitutes more than 80% of population is in rural areas where they are producing for use and maybe limited amount for exports or even for the market, which then means still smart agriculture will work, particularly encouraging irrigation at small scale levels, encouraging well as in learning institutions, and going further to ensure that the water that is available is well utilized, planting trees so that we are able to also attract natural rainfall, and reducing reliance on the rain-fed farming. And this will require advocacy, having like cooperatives even to invest in water pans in dry areas, and also looking at how the water is piped from source to the use, both in farms and also in households.
Thank you so much, Dr. Elda.
And that ultimately will improve on the health that.
Yes, please continue. Please continue. Sorry for the interruption. Please continue.
Maybe one final area then was to be on education, because as you said, these crops like fruits, they could be grown in areas where maybe the population may not know the nutritious status of these foods. So education also plays a key role, as well as social response to some of these shocks that come from climate change. Thank you.
Thank you so much. Thank you so much. Maybe we have some connection problem with your Zoom link, Dr. Elda. However, we fortunately got the most of your points. Now, actually, I do have a question for all my esteemed guest speakers, okay, about our global health systems. Are we, it will be very easy question. Are we in a good shape? Global, when we are talking about the global health systems, if we face like suddenly unexpected, unforeseen climate induced health crisis, can we cope? Are we in a good shape? Let me start with Ms. Lamazakzak this time.
Are we in a good shape? I think maybe the memory of the pandemic can sort of give us a lead on this question. I hope we learned lessons from the pandemic, because when it comes to climate change, events like emergency events like the pandemic is basically a stress test to see if the global health systems were prepared for something like this. I would say, although like there were a variety of levels of how countries or dealt with the pandemic, but when we talk about the global response, there were a lot of lacking in areas that certainly could have been prepared better to be able to deal with the pandemic. For the climate health, the climate change challenge, what we need is something even more resilient. So what do I mean by this? We need health systems that are able to basically assess vulnerabilities right before they happen. So we need to understand our vulnerabilities. And this is something that we sort of learned from the pandemic, to be able to identify the groups that are more vulnerable to the disease and be able to cater prevention measures to them in terms of vaccine or hospitalization and so on and so forth. The other thing, other than assessing our vulnerabilities, we need to be able to put emergency plans in place. And the emergency plans here will be different according to the needs of certain geographical or climate needs. For example, I'll give you an example that is happening right now when we talk about heat. There are many cities that learned, unfortunately, either maybe through the difficult way, they were exposed to a stressful heat event and they lost lives, and they saw how the health system can be impacted and put under stress. So they developed something called heat action plans. You have cities like this in the US, for example, California has one. You have the city of Phoenix is doing great when it comes to this, because Phoenix is one of the hottest cities in the US. Also in India, certain cities went through negative experiences when it comes to heat, and they developed heat action plans. The other thing, other than the assessing vulnerabilities and putting emergency plans, is to have a strong supply chain and be able to identify where it's the weakest, to be able to ensure a continuous supply chain of medical needs that are needed for prevention and for treatment. I think these are the most important elements. The fourth one, sorry, I wanted to add, is to work on two things which come under the same category, which is the hard component of the health system. Here we're talking about the infrastructure, and this comes mostly the importance of working on a strong infrastructure comes when we put it under the climate hazard lens. So if we have flooding, if we have hurricanes, a snowstorm, sandstorm, whatever, you name it, whatever climate stressor that can actually induce damage to the infrastructure, is very important to be able to predict it and put the protective or preventative measures to deal with this. And the second component within the hard components of the system is to work on educating the staff themselves on what is, because still now so many health systems around the world did not mainstream climate change or climate hazards within the way they respond to emergencies, and this is very important.
Thank you so much. Thank you so much. And actually, I wonder if you at Mohammed bin Rashid School of Government, and I know you guys have a lot of plans. Okay, do you have this heat combating a plan, the emergency one? If it's not secret, if you can share with us some enlightening about that.
You mean an emergency plan for?
Yes, for the heat waves.
For the heat waves. So
heat waves, I mean.
For the heat waves.
Heat waves emergencies.
So as a school of public policy, we do not have a heat wave or a heat action plan.
Yes.
We didn't also work on as an advisory for something similar. However, if we're asking about the UAE,
yeah,
if they have, I am aware that they have an early warning system. The UAE does have that. The UAE also have laws that prevent working in certain times of the day. I think recently there was an inspection done on thousands of companies to see if they are following this rule or not. The results were published in the media. The UAE also have the capacity as a health system. They have the capacity to deal with heat illnesses. It also, when it comes to the ability to predict weather and weather events, there is also a center here for that. So I'm just trying to list all the components that might contribute to having a strong response to a heat wave. And the other thing, though, that I think maybe there could be a way to spread awareness, not among maybe the local residents, they are quite familiar with heat and what heat can do, but maybe for tourists, that could be one of the areas. So yeah.
Thank you so much. So again, Prof. Jeremy, what are our situation in a global, on global scale, regarding our healthcare systems. Do we have the enough level of preparedness and readiness to face any urgent health crisis induced by the climate change?
Well, Mohammed, thank you. I think that Ms. Lama has said it very eloquently. Let me be less eloquent and quote the boxing champion Mike Tyson, who famously said, "Everyone has a plan until you get punched in the face." And there are many elaborate plans, but I don't think we have been punched in the face just yet. And
even by Corona.
That is, and you make a very good point, Mohammed. If we can frame a climate catastrophe along infectious disease or outbreak pandemic principles so that the average citizen or the policymaker can see the parallels, then we have, I won't call it a fully baked plan, but at least there are the bones or the skeleton of a plan that can be hopefully rapidly adapted. And some of the microstructures within countries, okay, and I won't talk about the global system because there really isn't a global system, but at least some of the national structures, as what Ms. Lama has shared, has indeed become more resilient. There are more optionalities. Supply chains are no longer just in time throughout. So I'm a bit more optimistic. Since you wanted us to end on an optimistic note, I'm more optimistic that we are better prepared in 2023 than we were in 2019. Right.
Okay. Regarding the medical supply chain,
yeah,
this is actually a very interesting topic. Okay. Do we still have our the laws and the barriers? Actually, it's I prefer to call them barriers regarding the medical supply and the pharmaceuticals. What if we have like an emergency, a catastrophic emergency health crisis? Okay, how can we deal with all of these barriers that intense or that actually strengthen the protectionism in against of the global collaboration?
Is that meant for myself? Yes, countries are starting to become less globally dependent. Many countries, for example, in vaccines, are starting to onshore. In my own country, Singapore, we now have BioNTech, we have Moderna that have set up factories as well as research facilities. So we are probably a little less vulnerable to the sort of nationalism or the protectionism that we saw at the height of 2020. That said, overall, the entire medical supplies system, pharmaceuticals as well as medical devices, it is inherently highly concentrated. So it's a bit like the chip industry with where I think everyone has said, oh, it's very difficult to be dependent on one or two countries, but the unwinding and the making a really broader base is going to take many years. And I'm not sure the climate change crisis will give us the luxury of time. But at least, certainly, Mohammed, the short answer is that the world is aware of this and trying desperately to make our systems of procurement and of medical supplies a little bit more resilient.
Okay, thank you, Prof. Jeremy. Dr. Elda, now regarding the measures that what are the proactive measures that we can implement or take or prepare at least? Proactive measure now, I'm asking, not the reactive one. Okay, to ensure that we can at least mitigate some of the climate health consequences on climate change consequences on our health.
The mitigation measures will start with implementing the early warning systems findings. And this is an area where most countries, especially in Africa, have managed. And here they've had support, particularly from the non-state actors, the NGOs, and also the communities. The governments have also invested in systems that you are able to forecast weather conditions over time. And this also can go all the way, not only in the short term, but even for more than 10 years, even 20 years or 30 years, so that we are able to then indicate what is likely to happen when it comes to climate change over time, and what are the early warnings that we really have to take care of. The other mitigation measure relates to human adaptation. And with human adaptation, I mean situations where even in areas where climate change is being felt, with technology, or even using the education that the people have, they can be able to put in place measures that enable them to adopt to the change that is happening. Another area is in ensuring adequate resource allocation when it comes to management of water, and also when it comes to droughts, investing a lot when it comes to ensuring that the air around us is of good quality. Another area of mitigation relates to social development, where you strengthen the social systems and the social networks so that the humans around any ecosystem, they are able to learn from each other as they adopt. And then finally, it's on education and the training, because with education and the training, then you are able to understand the emerging mitigation measures that are available to the populations, both at the level of national and also the community level, particularly the poor marginalized communities. Thank you.
Dr. Hilda, thank you, of course. But do we have like any successful examples, at least on the state levels, from the countries that we like kind of successful to in the mitigation plans, in the combating the health crisis or the health consequences induced by climate change? Do we have any example for a resilient healthcare system at the country's level? As far as
I could give is where organizations like the AMREF and also the Red Cross support communities when it comes to vulnerabilities from floods and droughts. They are able to be given medical emergencies. They are also being given food, clothing, health, and also housing support. That is a way of mitigating, because in most cases, this comes as an emergency. Another example is disaster investments. At the moment, most governments, including the Kenyan government, for instance, in the plans both at the national level and the county level, they are investing on disaster management and ensuring that we have adequate resource allocation for disaster. And this became apparent after COVID, whereby the government had to adjust the budgets to ensure that adequate resources are reallocated to the health system to take care of the emergencies. Another example is to do with the social protection support system, which also supports the nutrition status of those who are being affected by the climate change shocks. When it comes to the findings from the early warning and weather forecasts, adaptation measures can be designed based on some of this early warning, and also the case of higher learning institutions, which have the mandate of advancing research, technology, innovation, and this can be directed to the areas of climate change resilience, adaptation, and management. Thank you.
Thank you so much. Thank you. And now, actually, I want to also ask Dr. Jeremy Lim, in your opinion, what do you think the priorities that the priorities that we should have, okay, as proactive measurements to prevent or to mitigate also the climate change consequences on our health now and in the near future? It's the same question that I asked Dr. Al.
Yeah, thank you, Mohammed. Let me split this into a couple of different levels. At the individual level, I think science can be tremendously beneficial. I had shared that my university has got a heat resilience and protection center that interestingly is funded by the military, right? And the reason is that in Singapore we have a conscript military. So every able-bodied male is obligated to serve 2.5 years of what we call full-time national service, and because they have to undergo pretty strenuous exercises in the tropical heat, we are very concerned about heat stroke and heat injuries. And therefore, in your question, you asked Dr. Elda, has any country done anything? I would say that we certainly haven't done this at the national level, but the military has become a lot safer because there's been a lot of work into predictive analytics into what phenotype of individuals are at most risk for heat stroke or heat injuries. What are the preventive measures such as enough sleep? We basically check the soldiers' blood pressure, pulse rate before they start strenuous exercise. And so we have been able to bring down the heat injury rates pretty dramatically comparing today to say 15, 20 years ago. But this is certainly not a national effort. This is confined to the military. But I guess then the question is, at the individual, at the organizational level, can these things flow out of the military, much as many technologies and insights have in
governmental level, at governmental, apart from like at governmental levels? Not, I mean, Dr. Elda mentioned some non-state actors like Red Cross or other NGOs, but what I need now, okay, to know if at the state levels, government levels, do we have? I mean, do the countries have this kind of proactive measurements?
Well, but it's as they say, every man, every woman for himself, herself, and I think countries, particularly those that have the financial resources, are preparing at the national level. Right, so the low-lying countries are basically building dikes, planning for irrigation and the ability to move massive amounts of water. But do we have regional and global initiatives? It's a bit tragedy of the commons type of phenomenon. And to be very upfront, we've been talking about climate change for 20 over years. I think most countries' policymakers are firmly persuaded that it's real, and every country has its own sense of how vulnerable the countries are. But are we doing anything as a planet? Well, we have COP, and the hope is that this year will be different.
How do you think it should be different in regards to the health consequences of the climate change in this particular domain?
Oh,
How do you think COP28 should different in this regard? The negotiations, what shall they what they have to give as output in this regards of the health consequences of the climate change?
but you will not like my answer. It is, but I suspect that the bulk of what the health sector can do will really be around surveillance for pathogen, vector spread, and so on. But the real levers to slow down, reverse climate change do not rest within the health sector. So what the health sector can do is we can start to train medical students, nurses, and so on to be better prepared, to be more ready. At the disease surveillance and detection levels, we can institute measures like what I had discussed so that we don't wait for the pandemic before the world reacts. The world reacts when there's a localized outbreak. And hopefully countries will then mobilize resources to go to the area that is affected and essentially prevent the outbreak from exploding into a global pandemic. But these are, in a sense, band-aids over the issue, the fundamental issue, and the solutions don't lie within healthcare.
This is actually the problem, Prof. Jeremy. I mean, when you are talking about the health consequences, it's really, or the health impact, it's really different from any other issues because, okay, even, for example, you are lucky in Singapore that you have the resources to have your plans, UAE, USA, these rich countries, but the pandemic will not stop on your border. There is no chance for that. Okay, as Mr. Ma said at the beginning, it's the problem that we have now. It's transponded. Okay, so they will not stop here. So whatever you will do in your country, it will not succeed without the global effort. This is what we need to know.
Yes, no, and Mohammed, I agree with you fully, and that's why we have COP28 and all the previous COPs, because the world intellectually recognizes that. But the pain, the sacrifice, the expense, countries have not exhibited the willingness to endure for the sake of the planet or for other countries.
Yes. Yes. Okay. Thank you, Dr. Elder. Do you think the UN, including the UNFCCC, do you think they are doing enough to face the reality of the health consequences and impacts of the climate change?
They are doing work in that space, but more needs to be done.
Such as?
The UN interventions need to be in sync with the local community's needs. In most cases, the strategies that are used have been designed globally. But when they reach particularly the hard-to-reach areas, the local communities, they are either implemented in small scale or in pilots level, which we all know that climate change mitigation is expensive and the effects are quite fast. So even if you integrate some programs in a small area, the effects from other areas where there are no programs will be affected, which then means we need to look at even the financial infrastructure of climate change. How do we ensure that the UN institutions and also the Bretton Woods institutions, the IMF and the World Bank, they look at the way they are financing these developing countries, not only on climate change, but also on the remaining agenda when it comes to sustainable development, because managing climate is a way towards attaining sustained development. To do that, one recommendation could be UN institutions, besides working closely with the government, they will need to have their plans integrate the needs of the local communities. 2, allocate adequate resources on innovation and climate change, targeting the marginalized groups such as women, children, youth, persons with disabilities. 3, ensuring strong coordination. There is a lot of duplication, a lot of programs that are focusing on one issue, but then you find the funding institutions are not fully ensuring that there's no duplication and that there's strong coordination. 4thly, investing on impacts, not only on assessment, but ensuring that the programs on mitigation that are implemented are measured to see where we have greatest impact and those that can be expanded. Then finally, the political economy issue, which not only touches on the local countries, but also the political economy in the larger space globally. Thank you.
Thank you so much. And I wish that we in one day can see a sustainable political economy in somehow. Okay, I know it's it's not even a term and existing, but it does help. Ms. Lama, what do you think in the MENA? Okay, the most priority action that we have to take into to face the health related the climate change health associated issues.
So if we are talking about health in particular only and what the health system can be involved in and contribute to, of course, I would say exposure to climate impacts. Heat is one of the main issues that the MENA region is exposed to. Wildfires are becoming one of the emergent issues in countries like Tunisia, Morocco, Algeria. We have wildfires in Lebanon and Syria. Air pollution, air quality is another thing that should be tackled by the health system in the MENA region. And 2 more things that are connected and related. There are water scarcity. Actually, the MENA region is one of the most water scarce regions in the world. Very recently, the World Bank published a report saying that by 2030, which is not very far from now, available water per capita will fall below the absolute water scarcity level, which is, I think it's set around 500 cubic meter. Now, this coupled with urbanization and population growth that the region is seeing is definitely a huge challenge that is waiting to happen. We have droughts. Droughts are contributing not only to health hazard, but also to economic and political issues. And the other thing that is closely related, as I said, to water is food security. Countries that were able to manage through agricultural mechanisms to put, to grow food and be able to consume domestically and even export. Now they are faced with droughts in some areas, and these communities normally 2 things, not only drought, they also many of them depend on rain-fed agriculture, and the climate change is changing the precipitation levels in the MENA region. So all of these things put together, this is not to mention, of course, the impacts on the ecosystem. They are very, very important. And the last one, sorry, it's a long list and not very optimistic. The last
no
one
is okay. I think no one is.
The last one, because we talked about urbanization, the last one I want to really, really emphasize, and this is, it goes beyond the health sector, but we need to look at creating heat resilient or climate resilient cities. Cities often are under larger exposure to heat because of the way that the cities are built and lack of green spaces, which contributes to cooling. So we need to look and ensure that even if we're talking about high income countries that are able to adapt through, for example, air conditioning, we need to look at ways to basically try to cool naturally as well through green spaces, or dedicating public spaces that are that have shades or have a tree canopy and these kind of natural adaptive measures. So yeah, that's I think a list of things that the MENA region is currently exposed to and most likely will be exposed to in the future.
Very informative. Thank you so much for that. And regarding the sustainable infrastructure and the smart cities, we will have also one of our of the T28 activities will focus on that to highlight the importance of that for sure. Now it's for all of you, my distinguished speakers, your final recommendations for the negotiations in COP28 regarding the seriousness and the scale of risk and things to be done also for the climate change related health issues. We'll start with Prof. Jeremy, please.
I
Yes,
think,
please.
Mohammed, if we look back to the major initiatives that have changed the world, one of the big countries leads by example.
Mm-hmm.
So I am quite realistic that UAE, Singapore, we're not large countries. We're not going to move the needle. But as relatively more affluent countries, what we can contribute is money. But in terms of political will, in terms of soft power, it's going to be one of the big countries that has to lead by example. Right? Whether it's a global carbon tax, the Americans and the Chinese cooperate and they'll say that they'll shoot down planes that don't fulfill the carbon emission standards or whatever. I don't know, but I certainly do think that we're at the stage where desperate times call for desperate measures, right? But the desperate measures undertaken by small countries like ours will be limited in effectiveness. The bigger countries can lead. We can support financially as well as by our examples.
Thank you so much. Ms. Lama, you have like recommendations for or suggestions for the negotiations in COP28 regarding this topic in particular?
Sure. I mean, when we talk about climate action, of course, we're talking about the mitigation, adaptation, and the support systems, which is finance. And I think all three of them are very, very important to discuss. But for the health system, when it comes to mitigation, as the speakers mentioned, it lies outside the domain of health mostly. We are talking about the energy sector, the transportation, the technology sector. When it comes to the health sector, I think adaptation is very important. We need to ensure that the vulnerabilities to climate change are dealt with from an adaptation perspective, while at the same time ensuring that we are avoiding maladaptation, which is something that has happened before in some projects, where the intended desires were not achieved, or actually counter effects happened through adaptation practices. That's why we need to ensure that we engage the local communities, actually look at the actual needs on the ground, and be able to involve them in the negotiation process. Finance is also a very, very important element to tackle here. Even whether we're talking about mitigation, whether we're talking about adaptation, there's little that can be done without ensuring that the financial mechanisms are set in place. Innovative climate finance is a hot topic that is going to take a significant part of COP's negotiation. There's a lot of mechanisms that are being introduced to give enough flexibilities, especially when we were talking about countries that don't have the resources. And yeah, hopefully, on ending an optimistic note here, hopefully this COP, especially taking into consideration that we are going to check the progress of how countries are doing in terms of climate change through the stockpile this year. I think, yeah, we'll looking forward to hear the results. I think Muhammad is not here.
I think we have lost our
We lost our moderator.
Yes.
I'm very sorry. There was like disconnection from my side.
No worries.
Sorry for that.
No problem.
Yes. Yes, please.
No.
Hello?
Mohammed, yeah.
I
think
think
Dr.
we lost-
Elda, can you
lost
please?
again.
Yes. Hello. Can you hear me now?
Yes, I can.
Okay, I'm sorry. There was this sudden disconnection from my laptop. Now I connected via the mobile. So, Dr. Elda, regarding actually, I mean, at the beginning of this webinar, you mentioned even some solutions to confront the nutrition or the food deficiency and its sequences. And you mentioned some of the natural-based solution, which will be, by the way, one of the COP28 themes this year. Can you please elaborate more about that? How we can use our nature-based solution to confront the food deficiency and its health consequences?
Thank you. As a priority area, even as we move to the T28, nutrition is the foundation for human well-being. And given that importance, then countries will need to be encouraged to prioritize investment in not only food production, but nutritious, resilient food production, taking care of the community diversities and where the crops are grown and the types of varieties that grow in the various diverse areas. This also relates to looking at nutrition as an investment and not as a byproduct. In most cases, nutrition budgets are not even pronounced as when we have health budgets well pronounced. And yet, nutrition is the foundation of good health. So in that case, then we may need to invest heavily on production of nutritious foods, And these are also the traditional foods that are grown across the countries. Taking care of the weather conditions and also the equity and gender dimensions, looking at the areas of data and also access to water that will enhance the production of the nutritious foods. Another area is to do with tackling nutrition in a comprehensive manner. We know that nutrition, as Arya indicated, can be a byproduct of not only climate change, but other factors, other socioeconomic factors that have to do maybe with gender, maybe the urban areas which are informal in nature and there's no access to food, poverty, and not excluded. So in that case, then to tackle nutrition and also malnutrition, which is a dimension of food insecurity, it will be important to invest on the food baskets across all the households and ensuring that communities are involved, whereby they are able to discuss and indicate the type of foods that they have access to and those that they can exploit for improved security. We also need to tackle the emerging challenge of obesity because regardless of the priorities on stunting, wasting, and underweight, overweight now is a major challenge because of overnutrition for that matter. So it will be important also to look at nutrition from that dimension of obesity and overweight. Then finally, as a priority for the COP28, we'll need to advocate for adequate, improved nutrition, resource mobilization for water, sanitation, hygiene, and also investing in universal access to water, clean water, safe water, and universal access to nutritious food. Thank you.
Thank you so much. Thank you so much. I really enjoyed for listening to all of your insights and this valuable inputs. And I think now even our colleagues who take the notes, okay, that can be even included in the T28 reports. I mean, this is actually the aim of such webinars, to listen, to observe, to captivate your valuable insights as experts in this field. So just before finish this webinar, a last, like 1 minute, a last remark from each of you. Let me start with Ms. Lama this time. Hello? Hello?
Hello?
Yes, Ms. Lama. A final remark from you, please.
From me,
Yes.
final remark. Again, if there's something that I want to stress at the end of the day is the strengthening and expanding our ability to adapt to climate change hazards, in particular to heat and heat-related issues. And this lies out within the health sector and outside. There should be a multi-sectoral approach to climate hazards and heat. That's my final remark. Thank you.
Thank you so much, Prof. Jeremy. Please, your final remark regarding this subject. Yes, please.
I hope we throw away the rule book, right? And remember and really reflect that climate change is unprecedented. We have as a human race, as a planet, we have never faced anything of this magnitude, of this sort of complexity, and therefore traditional ways of working, traditional norms may no longer be appropriate. I hope that at COP28 we are brave enough to do things that we in 27, in 26, we may not have been bold or brave enough to do.
Thank you so much. Dr. Elda.
Thank you. The first take-home will be rethinking the resource mobilization and financing of climate change and adaptation measures, particularly for the developing countries, Africa included. This will require improvement in the financing infrastructure of climate change to ensure that all benefits, and also we tax any form of pollution, because then that is the first way of reducing the effects of climate change. 2 is to look at strengthening coordination and having a multi-sectoral approach for all the stakeholders, both horizontally and vertically. By horizontally, I mean across all countries, and vertically, when it comes within countries, we have to go to the lowest level, which is the community, to start from there. The role of private sector also needs to be brought up in the space for climate change, because the private sector has a key role, but when it comes to policy and discussions, they are not in the forefront. So it will be important also in the COP27 to ensure that we have the role of private sector brought up. Finally, water harvesting and also access to safe water, both to humans, animals, and also for crop production. Thank you.
Many thanks indeed for all of you, Dr. Elda and Prof. Jeremy and Ms. Lama. I'm truly grateful for the opportunity to learn from you and from your really valuable contribution in such important topic. Thank you for your contribution, and thank you. I want to extend our thanks to our audience for attending and listening to this webinar. Thank you all. Thank you so much.
Thank you.
Thank you.
Thank you. Bye.
Thank you.
Thank you.
Thank you.